Now, the federal government, through the Federal Ministry of Health, says the implementation of reproductive, maternal, newborn, child, adolescent, and elderly health plus will help in reducing the number of maternity and early childhood mortality increasingly witnessed in Nigeria. The Minister of Health, Osagie-Anire, said the FG would utilize untapped resources in the healthcare sector to reposition institutions to further reduce mortality and deaths. Benedict Uku has more.
Pregnancy-related deaths and early childhood mortality is more prevalent in low-income countries like Nigeria. Most of the maternal deaths in some areas reflects the inequalities in access to quality health services. At the 2023 first biannual meeting of Nigeria's reproductive, maternal, newborn, child, adolescent, and elderly health plus nutrition multi-stakeholders partnership coordination platform in Abuja, the Minister of Health, Osagie-Anire, represented by Dr. Salma Anas Ibrahim, rolled out the implementation plans of the RMINCAEH+N initiative beyond the 5 already dominated states targeted at closing the gap.
We are very optimistic to say that we look forward to seeing reduction in maternal deaths from the upcoming National Demographic Health Service 2023, and also improved survival of children, increased immunization coverage. We hope to see reduction in the deaths of children under 5 years, especially also children that are newborn, under the age of 1 month old. We want to have a good orientation so that states will know where they are starting from. So we have a statistics of each state showing the number of maternal deaths that happened in the last 1 year. So using that information, we're going to share with all the leaders of the states and the managers of health in the states so that they know where they are taking off from, and then guide them on the best practices on how to traject and quickly achieve reduction of maternal deaths in our communities and improvement of child survival.
The Minister of Women Affairs and co-chair of the coordination platform, Pauline Talon, represented by Oguche Gloria, said the ministry's efforts is to encourage maternity leave.
The Federal Ministry of Women Affairs, in collaboration with Federal Ministry of Labor, is working hand to hand to enforce the establishment of creche in all MDAs, to encourage mothers for this 6 months exclusive breastfeeding, and to also enforce women working in private sectors to have access to their maternity leave, because we hear stories of women who go for maternity leave in private sector being laid off as a result of this, and this shouldn't be encouraged. So the ministry is working in collaboration with Ministry of Labor to enforce this in all our working sectors.
The World Health Organization and other development partners urged the Nigerian government to ensure more access to primary health care.
WHO has always been a big partnership to this platform. And we also want to recommit or restate our commitment to ensure that the RMINCAEH platform is well established at the subnational level, and also to ensure that implementation to the last mile is delivered for these vulnerable groups.
88% of the world's poorest countries do not have access to essential health services. Here in Nigeria, the challenges are significant. The government, working in partnership with the international community, through initiatives such as this to end preventable deaths, needs to rebuild an accessible and functioning primary healthcare system.
I would once again like to reiterate our commitment to the advancement of this program in the country. This would include a nomination of a champion amongst the governors. I think that was a decision we took in this area to lead the campaign as we transition into the new political dispensation. We've also agreed to make this part of our induction program when we meet in May.
Key stakeholders in the health sector say strategic direction is needed for the delivery of quality reproductive, maternal, newborn, child, adolescent, elderly health care plus nutrition services in Nigeria.